A quick recap video of our first session. Now, despite this being on YouTube, it is only visible by you or anyone who has the link that I sent you. So unless you pass it on, no one else can see it, and it's not actually searchable, so people cannot find this. Okay, so quick recap of the lot. We're going to start with your seated glute stretch. So remember this, we start with our left leg, so I'm going to put my right out straight, position the left ankle on top of the knee, slowly glide my right heel in, and maybe perhaps a gentle bit of pressure down on top of that left leg with your hand. Lift the chest into spinal extension, stick your tailbone out and bow forward and breathe. Now, just hold this statically. Try and go for 45 seconds plus. If you can hit the 2 to 2.5 minute range, that's really what we're looking for. All right, breathe and maintain that spinal position. The slightest bow is all you need. All right, hold, relax, and remember your breathing pattern. Those long exhales upregulate the parasympathetic response in the body. Yeah, that neurological come down. So whilst you're in that position, as you take those long cascading breaths out, it encourages tissue release, neurological release. All right, second movement. After the release, you're going down into your cat-cow, that full spinal flexion to spinal extension drill. Okay, so from there it's on hands and knees. You start by looking down, pulling the abdominals in and tucking the tail between your legs. And really try and fold into full flexion. My head is round, my tail is tucked, my tummy is burrowed up in towards my spine. From here, I slowly, with intent and purpose, move into spinal extension. Lifting the ribs, pushing the tailbone up to the ceiling, and stacking the spine. Hold and breathe. And then slowly rotate again, pulling the abdominals in, going into flexion. Now, during flexion, push your hands away from your knees to increase the irradiated strength. During extension, as I look up, I'm going to try and pull my hands towards my knees to increase extension. You want to slowly transition between the two 5 times, holding each one for 5 to 10 seconds, or maybe 1 to 2 long breaths. Every time, just see if you can increase that range in both directions. Try and hunt out the tight spots as well. If you're moving through that position and you feel that that's lower back, that sort of thoracic lumbar junction we were talking about during the session, if that's where you're feeling particularly tight, try and bend through that position. Place your mind's eye there. Afterwards, we then focus on just the lumbar. So remember, the way to focus on just the lumbar is we take your upper back, your mid to upper back out of the equation by bending the elbows, tucking the head round, supporting the head, rounding the spine, and then focus just on that pelvic tilt, forwards and back. Irradiating strength from the belly outwards, I push my tailbone up and slowly tuck the tail between my legs. Transition every 5 to 10 seconds for 5 repetitions. When you move, picture yourself moving through treacle. Yeah, remember the air is more dense around you as you purposefully flex back and forth. Irradiate strength to whatever you feel comfortable with. You know, if you move through at 10 to 20% of your maximum strength, fantastic. And if it's causing no pain, obviously that's where you want to be. If you feel like you can ramp that up to 50%, 60%, 70% of your max effort where you're really squeezing and irradiating strength to go through it, fantastic. That's where you want to get to. but never push through pain. All right. Next one after that is your release. Is that lower back release. Where you spin around, you lie on your back, and you slowly allow both legs to drop to your right with knees bent. My left leg then slides up and connects in behind the right knee. I use my right arm to gently then push down over the top, pivoting over my bottom leg until I feel that release up into my spine, my hip, and perhaps even across the chest and shoulder on my left side. Nice deep breaths. And again, at this point, focus on those long exhales as you push down. Yeah. You can hold this one again for up to that 2 to 2.5 minute mark, as long as there's no pain. Yeah. And then change sides. The opposites apply on the other side. As I drop to my left, my right foot slides up behind the knee, trap the knee on top, and begin to push down. Opening up along that fascial train through the body. Hold and breathe. Concentrate on those nice deep breaths. After that, you're going to stay on your back and you're doing the peel and spread of the spine in the hip bridge. So remember, this is when you're segmenting the spine one at a time, lifting up. So arms flat down on the floor. Push the belly to the ceiling first, creating a space in your lower back. Yeah? So I'm then doing an anterior pelvic tilt. I then draw in, pushing my lower back to the floor, and then squeezing my bum, I slowly peel my spine off the ground, one vertebrae at a time. When you get to the top, you should still have that dish shape through the belly. I'm still tilting my pelvis back, squeezing the bum. And then I slowly spread one vertebrae at a time from my shoulder blades all the way down to my sacrum, where I then tilt forwards once and tilt back, draw in and go again. That slow squeeze, draw up to the ceiling and hold. When you get to the top, do a 10-second hold, squeezing through the glutes. And it should take you a good 10 seconds or so to lower yourself down and to come back up. When you feel comfortable with this movement, you can start having it last, but not last long, so you can start having it go quicker. But take your time at the start. Just slowly back and forth. You're trying to segment the spine as you go. When you finish, you can go back to the glute stretch if you want to, or you can go back to another one of those on each side if you wish. Mobility is key. The more you move, the better. Always avoid pain. All right. I hope that helps, and I'll be seeing you again next week.